Hi, everyone. I'm Diane Brady. I'm here with Chris Molaro, who is co-founder and CEO of NeuroFlow. Chris, you're wearing the company shirt. Let's start first. Welcome, and what does NeuroFlow do?
Thanks for having me, Diane. I'm really excited to be here. We are a technology platform that partners with health systems and payers to help care providers integrate behavioral health into their settings. Traditionally, we're working with non-behavioral health providers to help them really treat patients more holistically when it comes down to it. We could get more into the details, but in the simplest form, that's what we do.
I guess, and I'm curious, I know you've got your own experience. You're a former U.S. Army captain, and we can talk a bit about that. But with all of the technology coming out, are we actually getting better at detecting signs of mental distress? Or is it just, it's really
we are
proselytizing?
We absolutely are, and it's interesting. So some of it is as easy as asking the questions more frequently or at the right time. Traditionally, you're only asking if someone's depressed or anxious during your annual wellness visits, and that's on like a paper and pen questionnaire, right?
Or they're weeping in the bathroom, or
That's right. Depression doesn't happen just once a year when you're in the doctor's office. And so being able to ask them more often and the right questions in a safe manner has tremendous results. In addition to that, we know that there's a tremendous, first of all, the mind-body connection is better understood today than it's ever been before. And so when someone is stressed or anxious or depressed, that physically manifests itself in ways that you can measure, right? Your voice changes, your heart rate changes, and using all of those different data signals gives us a pretty clear picture into someone's mental health.
I want to get into some of the data, but one of the things that intrigues me initially, almost like saying I'm from the government and I'm here to help. I'm your employer and I want to know how you're feeling. My instinct is to say, fine, thank you, and none of your business. How do you get around that?
It's a really good question. And so first of all, NeuroFlow's focus, most of our partners are not in the employer space. We're working with your care providers, the physicians that are treating for you, which is a much different dynamic, obviously. In the cases that we do support employers, and we do support employers, the system is completely confidential and anonymous to where the employer can see. The employer can't see down to Diane's level. They could only see the macro trends in their company. So they could see, okay, is depression or anxiety trending higher or lower, but they can't at all see if Diane or Chris are struggling at the individual level.
So talk about how, so you get the platform, you're doing these surveys. What has been your reach so far in terms of the data set that you've collected since 2016? How broad is it?
So we service 15 million people today in all 50 states. And what's really interesting, it's not just the number of people, but it goes back to what I originally said, which is the frequency at which you're talking and collecting these data points, right? It really hasn't been done at scale where you track someone's progress treating their depression or anxiety longitudinally. It's crazy. I mean, think about if someone had cancer, they're going to get the tumor measured, and then they're going to go through treatment, and then they're going to measure the progress of the tumor. That doesn't happen in mental health, or historically it hasn't. And so we're collecting this huge data set, but it's also in the context of different types of treatment and longitudinally, which is very unique, and it happens to be very robust over time. And it's, I think we're just scratching the surface.
What have you gleaned so far? I mean, I know we've had the pandemic suddenly, drop 4 years into the lifespan of your company, but as you've done these longitudinal studies, any interesting data emerging that you'd want to share?
Yeah, absolutely. Well, I think there's really good news here in the sense that a lot of the care models and the treatment protocols that have existed for a good time now have actually proven to be quite effective. It's not a matter of needing to reinvent the wheel and creating new therapies or medications. Certainly there are areas to improve, and there's a lot of exciting things in that area. But the good news is that the cognitive behavioral therapy, as an example, works really well. Integrated care models like the psychiatric collaborative care model, where a psychiatrist and a therapist are embedded with a primary care provider work really well. The challenge with these models is that they don't scale efficiently,
Right.
and to actually get people to engage with them is the difficult part, which is where technology can help bridge that divide. And so we've just been able to, in a sense, reaffirm what we knew, which is that these models work, but then reaffirm that when you use technology in the right way, you could remove those barriers to
Hello,
access.
chat, GPT, and such, right? From
That's
your new
right.
therapist. Let's talk about some of the sources of mental distress, and have they changed, especially with the pandemic, where I think mental health really sort of went onto the radar in a new way.
Yeah, I mean, I guess that, and if there was a silver lining of the pandemic, it was that we're more adapt to talking about these things, and the first part of fixing something is talking about it. I wouldn't say that there are new signs or signals, but there's certainly, I think, new causes of stress. I mean,
Yeah.
think of loneliness, right? Of when we were in quarantine, feeling claustrophobic in a way. I mean, in reality, our entire society went through a traumatic event all at once together. And we haven't really had a time to process that, what happened, and make sense of it. And anytime a traumatic event happens, you really want to be able to, I mean, think about when there's a mass shooting, or there's something, or you're in a car accident, or in the military, if we're in combat and come under fire, you have to have a moment where you could process that and understand it. Otherwise, you're more at risk of having PTSD or depression and so forth.
So when we look at certainly the economy has now a stressor for many people, whether they're losing their jobs, they're tapping into their 401ks and such. These we've talked about some of the external factors. Are there other signs, signals that again you've gleaned from your data as to start with signs of mental distress? Then we can get to what gets us out of it.
Yeah, I mean, literally, what our data does is we're not diagnosing mental health issues, at least not at this point.
Right.
We still need that medical provider to take a look at the data, right? But what we are able to do is what we've shown is there's a higher frequency of people endorsing thoughts of self-harm, possible suicide ideation. And it's interesting when you look at the data, you see certain spikes in certain populations or regions, and then you look at the news and it's correlated with different, things going on. Maybe the stock market took a big dip, or there was a mass shooting event, and you see this corollary effect with people's stress, anxiety, and even thoughts of self-harm, depending on the event and the time.
So I'm going to put myself in different roles here, and let's take the role of the employer, which is I may not get this data, but I've got a population of workers. I'm concerned about mental health. What advice do you have that you can sort of, you both derive from your data, but also just from these spikes that you've seen in terms of anxiety and other issues?
Well, I think in some parts it comes down to leadership, really, and policies of those employers. I mean, empathy is number one. And, from a business leader's perspective, it's not only the right thing to do from a human perspective, it's also the smart business thing to do. Because if you have a large group of your employees that are getting burnt out, or are going to be suboptimally performing, or increase absenteeism because of these mental health issues, I mean, your business is going to struggle too. So it's not only the right thing to do, it's just the smart thing to do.
And name it too. I remember, with George Floyd, for example, there was this impetus to step up, to talk about race, to sort of be aware of it. We don't always do that when there's a mass shooting or some other event. We tend to sort of just go about our day.
That's right. It's there's a popularized saying recently saying it's okay to not be okay. I would amend that slightly, and I'd say it's okay to not be okay, but then take it a step further, and there's treatment options out there that are available for you. There's help available. So it's okay to not be okay, but then, right, don't just don't be malignant in a way. You can go out and get get that support that's
Right.
available to you. And a lot of companies today offer that
And for
support
the
as well.
individuals, I know there's obviously many, many different treatment protocols, many different signals. What advice do you have, again, from what you've learned so far and what you would say to friends and colleagues?
Well, I would say, look, there are a lot of different treatment options out there, and not everyone is right for everybody. And so, we have a saying at the company: it's right person, right level of care at the right time. Not everybody. I mean, I live in Philadelphia. It's February. It's cold. The days are short. There's
You
a,
have the Super Bowl at least,
well,
or
yeah,
will
that's
have
right. So
had.
so
Yes.
maybe that's
Let's
helping, but seasonal depression is a real thing. And kind of that fatigue and just wanting and feeling down and tired is a real thing.
Chris,
That
what are some of the signs that you would suggest people watch for? Because we're not always attuned to our own mental health.
it's really tough. And frankly, that's, I think, why technology is very important. Unless you're a trained mental health professional, you might not know what signs to look for. They might be so subtle. Things like absenteeism, especially when anything that's an irregularity, right? If I'm normally on time for things and all of a sudden I'm showing up late and I'm less pronounced in meetings, and when normally I'm full of energy, like that's an irregularity. Now that just might be because I'm having a bad day. It might be because something else is behind there, right? And so usually what I recommend, what I've been taught, everyone at NeuroFlow, by the way, takes mental health first aid training. It's a part of the onboarding at the company. And what we're taught in that training is to just ask, to have a private conversation, maybe go on a walk and say, "Is everything okay, Diane?" And if things are bubbling up or are so bad that you think that there might be a chance of thoughts of self-harm, as awkward as the question is, it's been taught to us through first aid training to have to ask the direct question, like, are you considering killing yourself, Diane?
Yeah.
And you would be surprised with, I think, the honesty that some people come back with. And we don't have to go through the training right now, but there's a number of different steps that you can do to help mitigate that risk and de-escalate
Well,
that thought.
let me ask, I think it's so important. And, I've had family members go through this myself. I mean, we can't do the full training, but what are some of the questions we can convey to people that really do make a difference?
Well, so suicide ideation, and I should say I'm not a trained clinician.
Of
I
course.
surround myself by trained clinicians at the company, and what they've taught us is suicide ideation, like anything else, is a spectrum. So depression, for example, is not binary. It's not you have depression or you don't have depression. There's varying degrees of that, and the same thing with suicide ideation or thoughts of hurting yourself. There are some people that kind of just wake up really tired and aren't motivated at work, and have thoughts of I would be okay not waking up. To then there's more serious times where people actually have a plan, and that's really what you're trying to get out of it. And there's an assessment built into NeuroFlow that providers can deliver, which is called the Columbia assessment. So the Columbia assessment not only says are you potentially suicidal or not, it measures the degree of severity and the time sensitivity of it. So do you have a plan? If you have a plan, what is that? When is it? And some people might just be, I'm just tired. But if someone's like, no, I have a plan, I've identified the weapon or the place and the time, and I have my notes written, obviously that's a more time sensitive issue that needs emergency care.
Right. Let me ask, and I mentioned that you are a former U.S. Army captain, and thank you for your service to the country,
Thank you.
first of all. And I know that, anyone who's had friends, family, even read the news about these tours of duty and the impact it's had. Talk a little bit about your own story in terms of how this became an interest for you.
Yeah, I mean, and it's tough to talk about for anybody, right, that's been through this, but it's something that I'm proud that we've been able to start this company to hopefully bridge that gap out of a negative situation. And when I was actually a lieutenant at the time that we deployed to Iraq for 12 months, and we were doing combat missions almost every day. And when you are like quote unquote when this elevated, escalated mindset of fight or flight 24/7, 365, it's really hard to then come back down to that and get reintegrated into like quote unquote normal society.
Yeah.
And so we all, like, if we're being honest, we all had challenges with either sleeping, nightmares, right? We would be easy. It's a lot easier to get agitated, like low patience, being jumpy. And I had one soldier that was being seen for some physical injuries, and was going to physical therapy. He identified himself of needing an extra level of support and was given medications and a referral to therapy. And in the military, I mean, talk about access being all the barriers being mitigated. It's free, it's all on base, it's local. And then we lost him to his battle and he took his own life. And, we looked back at what happened, and it turned out that he never actually went to the therapist or filled his medication prescriptions. And so, I guess we'll never know why for sure, if it was a stigma issue or he was worried about his job security or something along those lines. All we know is that he didn't get the care he needed, and no one really knew about it until it was too late.
How would a platform like yours address that? Would it basically be the healthcare providers reaching out saying, hey, how are you doing on this? Or how do we bridge that?
Yeah, well, you're exactly right, except to have a healthcare provider do that at scale would be almost impossible. Like you can't, that would be way too expensive and inefficient. And so what our technology does is we automate that process for the providers, reaching out to them, that sends it back to their electronic health record so they could be informed on how to best support, the people in their population.
One other question, Chris, before we leave, which is there's been a lot of attention in the news around generative AI. I mentioned ChatGPT earlier. What impact does that have, or could it have, on an industry or company like yours? Because we're now hearing about the potential for machine learning to actually be adaptive as a therapist, never mind tracking our symptoms. Are you looking into it?
We certainly are. I mean, we do have AI built into the platform today where we run natural language processing algorithms on free form text. So, right, if you write your doctor a note saying, I really need help right now, this is not this is an emergency, we're able to pick up those words and flag that account so that they could be more proactive. And so I think, right, we're just scratching the surface. When you look at something like ChatGPT, it has the potential to be transformative. That said, I'm a big believer at the company, we say high tech, high touch. So using technology to bridge the gap, to be a force multiplier of the providers that are in the system, but not to be a replacement to them. There's always going to need to be, at least in our lifetime, that human connection. And so I think that's where that technology is going to play a part.
Well, thank you. I'm sure more conversations to come, and thanks for joining us, Chris.
Thank you so much, Diane.